Hi friends, welcome to your personal child specialist podcast with Dr. Gaurav Gupta, MD. I hope you're all doing well and the kids that you're caring for are doing fine too. Today I'm going to be talking about the common causes of fever and how to correctly calculate the dose of paracetamol or acetaminophen. You would be surprised to know that as per a recent survey, almost 80% of parents are unable to dose the child's liquid medicine properly. 80%. That means 4 out of 5 parents are not doing this right. Now, since acetaminophen or paracetamol and ibuprofen are the most commonly used medicines for fever, I thought that getting to know the correct doses of these two medicines would be a big help. But before that, let's look at the common causes of fever. Well, the top 3 common causes of fever in kids are: number 1, viral infections, which include stuff like common cold, flu-like illnesses, diarrhea, and then of course infections like chickenpox and measles, though now these are getting a bit less because of the vaccinations, but we have similar viral illnesses that can have a rash with fever. Number 2, we have infections of the upper respiratory tract like tonsillitis, ear infections, or gut infections like diarrhea, or urinary tract infection, especially in smaller babies. And finally, we have vaccines. I have done this in a separate podcast, but vaccines are an important cause of fever. Generally, this will occur in the first 1 to 2 days after the vaccine, but in some vaccines like chickenpox and MMR, this can happen even after 1 week. So these are the top 3 causes of fever: viral infections, infections of the upper respiratory, gut or urinary tract, and finally vaccinations. So what are the things that you should or should not do in fever? For starters, please don't panic. Remember, fever is your friend. The reason why the body becomes febrile, which means it gets fever, is because it tries to work up a proper protection against any infection. When a body has fever, all the enzymes in the body are working faster. All the antibodies and the cells that are going to attack and destroy the virus and bacteria are working better. So a fever up to 100 or 101 is generally not a bad thing at all. It's a good thing. When the fever goes beyond 102 or more, that time the most important thing is to find out the cause of fever. So that is the time when you really need to talk to your pediatrician and get the child examined if the fever is more than 102 and has gone for a day or more. Of course, for smaller babies, you probably need to visit the pediatrician for lesser amount of fever also, or especially if they have other symptoms like excessive irritability or very bad diarrhea or any other things in which they look very unwell. But for a regular child, say above the age of 2 years or so, who's happy, playful, active when he's febrile, and who doesn't really get fever beyond 102, well, this child is unlikely to have any serious problems. So what should you do? Make sure that the child gets more fluid so that he's hydrated. Follow the doctor's instruction as far as the medicines are concerned. Check the temperature. We have discussed this in a separate podcast, but either use a conventional digital thermometer or you can use a proper temporal artery or an infrared thermometer for monitoring the fever. You can check the fever at night as well when the child is sleeping. And if the child appears very, very unwell or very, very sick, it's time to call or visit your doctor. What you should not do: don't worry too much about the child's appetite. Anybody who has fever is not likely to eat a lot, whether it is us or whether it is a child. Don't overdress your child. This can cause fever to spike. Also, unless and until the child insists, don't underdress them also, because the child may feel a bit cold, he may start shivering, and that will again cause muscle heat to be generated and more fever to occur. And finally, this is something which all the parents are guilty of not doing, that is, please don't send your child to school. Look, almost 80 to 90% of the viral infections which are causing fever in kids are infectious. And if you send your child to school, he or she will transmit the infection to other kids. We always keep on telling the doctor that he went to school and he got infected from there. Well, the reason is because other parents send their kids to school when they had fever. And now if you do the same, you are repeating the cycle. So rest for 1 to 2 days if you have fever. Finally, coming to the right dose of medicines for fever. So let's look at paracetamol. There are many trade names like Crocin, Calpol, Baby Jessic, etc. And this is basically a molecule called acetaminophen. There are 3 things which you have to remember. There are 3 forms of paracetamol that are available. One is the drops, second is the syrup, and for most paracetamols there is a double strength syrup also. The best way to figure out the correct dose of paracetamol is by reading the labels. Most of the paracetamol drops, syrup and even double strength syrups have the doses mentioned on the label as per the age and the weight of the babies. I recommend that we use the weight of the baby as a proper guide because sometimes the child may be underweight and overweight. So use the weight of the baby and ensure that you are giving a proper dose according to that. For simplifying the calculations, here is what I use. For children less than 1 year, we prefer drops. How many drops? Just double the weight of the child. So for example, if you have a 5 kilo baby, the dose would be approximately 10 to 12 drops. If you have a 8 kilo child, it would be around 16 to 18 drops. So that is how I remember the dose of the drops up to the age of 1 year. Now the syrup is recommended between 1 to approximately 5 years or so, and the dose would be 5 ml for 10 kilos. So normal paracetamol syrup, just use 5 ml for 10 kilos, which means if the baby is say 15 kilos, you can use 7.5 ml. Finally, if the child is above 15 to 20 kilos or say 4 to 5 years, the double strength paracetamol is preferred, which may contain 240 to 250 milligram of paracetamol, and the dose that is recommended in this situation would be again 5 ml for 20 kilos. So because the dose of paracetamol is doubled, therefore the weight of the child is also doubled. So just to repeat, for the drops, the number of drops that are required are double the weight. For the syrup, 5 ml for 10 kilos, and for the double strength syrup, it is approximately 5 ml for 20 kilos. For ibuprofen, the dose is 10 mg per kg, and normally again it is approximately 5 to 7 ml for 10 kilos. So if you have a 10 kilo baby, you want to give any ibuprofen syrup, normally it is available like Combiflam, Flexon, Ibugesic Plus, etc. Normally the dose would be around 5 to 7 ml for a 10 kilo child, and for a 20 kilo child it will be double that. So almost 10 to 15 ml. Ibuprofen does not come in a double strength, so you will have to give much higher doses of ibuprofen in this situation. The third fever medicine that we use a bit less frequently is mefenamic acid, again coming with the trade names of Meftal-P, Mefcox, and that is used a bit less, and for that the dose is on the lesser side. So these are the medicines that we use for fever control. But remember again, fever is a friend, number one. Number two, It is much more important to find the cause of fever rather than just bringing it down. Number 3, use the proper dose from a dropper or from the cap rather than using the spoon directly, because a spoon size can vary a lot. And last but not the least, in addition to medicines, sponging is extremely effective. How to sponge? Well, there's another podcast and a YouTube video for the same. So subscribe to my podcast, subscribe to the YouTube channel, check out the tepid sponging video or the podcast, and of course, as always, leave your comments, share this with other parents who have small kids, and you can always write to me directly at yourpersonalchildspecialist@gmail.com. Till the next time, take care.